So as Steve mentioned, I'm the CEO of Simplifiance. We are a behavioral healthcare compliance solutions company. As Steve mentioned, we were founded in 2017, and our first service line was really specifically around consulting. So helping organizations become licensed, to earn accreditations, to successfully renew those licenses and accreditations. And our services have sprouted out to adding a software as a service to be able to help automate and track and manage those compliance requirements over time. And then also an ongoing compliance subscription if you want a compliance specialist to be able to call, get questions answered, get help with root cause analysis or changing policies, and adopting changes in regulations. So as Steve mentioned, we're a mission-driven team of behavioral healthcare experts. We've got a team of folks that come from the regulator side, that come from the provider side, and we're really honored and pleased to have such an amazing team delivering services all around the country. So Steve, if you wouldn't mind jumping to the next slide. So what we do, our consulting services and software provide simple solutions to the unique challenges in mental health and addiction treatment compliance. There are a number of different activities, reports, discussions that need to be had in order to remain in perpetual compliance with licensing and accreditation standards. We help guide organizations on everything that they need to do in preparation and from an ongoing standpoint as well. The way that we do it is by providing the knowledge, expertise, and ongoing support to ensure organizations maintain the highest standard of safety and quality. Our mission is to support the growth, development, and refinement of behavioral healthcare organizations seeking to make a positive impact in the lives of others, and our vision is a higher standard of safety and quality in healthcare. Next slide, please. Briefly introducing some of our leadership team. As mentioned, I'm the CEO. Braden Smith, Juris Doctorate, is our Executive Vice President, has a corporate healthcare background through Kaiser Permanente, is also a University of San Francisco School of Law graduate. Tim Smith is our Chief Financial Officer. He's been in business both as an employee and as an entrepreneur for over 35 years, bringing a vast amount of experience from the financial side. Sam Sine is our CTO. He's the architect of the software platform that we've built, boasts over 40 years of experience in tech, University of Pepperdine graduate, early employee at Sun Microsystems, and been in the entrepreneurial space for quite some time now. Gina Thorne is our Chief Marketing Officer, formerly at Lakeview, and then most recently Chief Marketing Officer at Harmony Foundation, which is one of our customers as well. Next slide, please. Marley McGee's our operations manager. She's spent close to the last 10 years working on the provider side and operations and compliance within the addiction treatment space, mostly in Colorado or California and Washington State, but now having worked with Simplifiance, operating in a number of other states as well. Sierra Paratori is RPI Yellow Belt certified. She was previously employed by the Joint Commission. She's our licensing and accreditation manager and works on the consulting project-based side of the business. Nikki Rutger is our Director of Continuous Compliance. She services the ongoing compliance services department. Nikki has over 20 years of experience in quality improvement and compliance, both on the inpatient and outpatient side of psychiatric, adolescent, and children's mental health services. Trevor Stein's our lead developer and a full-time contributor towards the software platform and all the other technological needs of the company. Ayana Marshall has come on as our product and operations specialist. She supports with the implementations of new software instances with our customers, as well as provides ongoing support for the use of the system. Next slide, please. So in today's webinar, we're going to focus on a few different specific areas. And what we're hoping to be able to achieve for each of you is an ability at the end of today to be able to reframe perceptions about compliance and what that is and what that means, define value-based compliance and the core concepts of that notion, determining the return on investment of a healthy compliance program, learn how quality reduces the need for quantity. We're going to assess how data transitions into the impactful stories that tell us what we need to do to improve as organizations and businesses and providers. And then we're going to briefly overview the upcoming changes in behavioral healthcare regulation in the state of Colorado. Next slide, please. So before we jump into some of the more granular details, I want to provide what we see as our definition of some pretty important operative terms that are a part of today's webinar. So first and foremost, compliance is what we define as acting in accordance with laws, regulations, and standards of compliance. Safety refers to not only physical safety, but also mental and emotional safety. And culture, I really like this quote from Julian Liu. We would describe as the sum of your formal and informal systems and behaviors and values, all of which create an experience for your employees and your customers, or in our specific industry, patients, clients, members, individuals served. Next slide, please. So what is value-based compliance? Value-based compliance is a term that I recently coined based on the 10 plus years of experience working in behavioral healthcare. I started as a counselor, was an early employee at North Star Transitions in Boulder, Colorado, quickly moved into a director of operations role where we moved from a recovery coaching model to adding IOP, PHP, and then actually becoming the first state licensed residential treatment center in the city of Boulder and opening more thereafter. So as part of my role at North Star, I managed our licensing with the state. I managed our national accreditation with the Joint Commission. And really that's where my love and passion kind of came in from the safety, quality, and best practices standpoint. So the word value can be framed in a couple different contexts. The first would be numeric, such as a price or a dollar value, or in the context of importance to the individual or an organization. So value can be really framed in a couple different contexts. In our value-based compliance model, we really see it as both. So organizational values and the institutional commitment, and then also the financial impact, whether it be savings, earnings, or organizational valuation, or the direct value of what the business is worth. Value-based compliance, the definition that I've spent a long time, cogitating on and kind of curating over time, is an investment in cultural safety, quality improvement, and regulatory compliance that provides measurable financial and social benefit to an organization. Next slide, please. So I'd simplify, it's our belief is that compliance fosters a culture of safety. A culture of safety promotes quality care. Quality care translates into successful outcomes, and successful outcomes equals organizational and community health, wellness, and prosperity. As most of us know, value or outcomes-based care is the focus of the behavioral healthcare industry moving forward. Next slide, please. So let's talk about safety first. As I had mentioned in our definition, we refer to safety meaning both physical, mental, and emotional safety. And we believe that organizational health is built on the foundation of a culture of safety, which is a phrase that the Joint Commission accrediting body introduced to the industry a while back. That really focuses on those three different components of safety that I had mentioned: physical, emotional, and mental. And we'll continue to kind of unpack some of the concepts around culture of safety throughout the presentation today. Culture of safety also includes the financial security of the business. And that is not just specific to for-profit organizations. That's specific to nonprofit and governmental, which we work with all of. We're in the for-profit, we're in the nonprofit, and we're in the government sector. And financial security is imperative in order to maintain safety of individuals being employed, to be able to take patients, clients, and individuals served into the program. And so ensuring the safety of the finances and the stewardship of those is imperative to the safety of the organization. We subscribe to the Joint Commission's belief that leadership is ultimately accountable for all outcomes. And that includes the response to adverse outcomes. In behavioral healthcare, there's a number of different outcomes that result from treatment episodes. And we believe that the efforts and the oversight and just overall approach to leadership really has a direct impact on the outcomes of the staff and also the patients and the clients as well. A culture of safety increases institutional confidence across all departments. We see organizations ranging widely in terms of their approach and seriousness to the compliance program. And what we see in the organizations that have a strong commitment and an investment in their compliance program have an institutional confidence in their ability to serve patients and clients, to take care of staff, to address incidents, and to continue to grow and improve, whether it be adding locations and levels of care, or simply being able to expand their average daily census and the amount of patients that they serve in a single facility or multiple facilities that they currently have. Next slide, please. So the Joint Commission recently did an independent third-party study that found that organizations that invested in becoming accredited saw a 623% return on investment, which is, for any company owner, business owner, leader within an organization, what you're looking for when you make decisions is a return on investment. So in this independent study, what was discovered was one of the greater benefits was employee retention. Turning over employees, having to pay recruiting fees, having to pay headhunters is very expensive. So organizations that go through the accreditation process and adopt all of the policies and procedures required are really seeing not only a benefit on the financial side, opportunity with payer contracts, higher rates of reimbursement, but also improved retention and reduced attrition of employees, which is a super important factor and a huge challenge in our industry. Workforce and HR challenges are rampant across all industries right now. It's especially the case in healthcare. And Joint Commission or CARF accredited organizations are seeing a huge return on investment of going through that process and maintaining in good standing as it relates to their bottom line. So this is a very important metric that we wanted to share for those organizations that are not accredited, or for those that are, to really appreciate some of the benefits of what they're receiving outside of maybe what some of the obvious reasons would be: marketing, payer negotiations and contracting, being able to take certain policies, things of that nature. So next slide, please. So unpacking a little bit deeper the return on investment, I kind of scratched the surface on this last slide around the Joint Commission's independent study of a 623% return on accreditation. For anyone that wants to follow up, we can provide a link to that third-party report. They're certainly maximizing it in their marketing efforts on the Joint Commission side, and we're using it as a tool to help educate the industry as well. So we'd be happy to share that article outlining that independent study. The return on investment of a state license and a national accreditation, or a good standing with the regulatory laws, whether it be local, state, or federal, ensures the organization's ability to legally operate. So it's really not a choice whether or not you are in compliance to be able to legally operate as a business. It's what level of approach do you take to your compliance program, whether it be seriousness or lackadaisical or somewhere in between. There's no choice whether to be compliant. It's how you choose to approach it. And we feel like as an organization, we provide unique solutions that are cost effective, that increase that institutional confidence, and also make sure that you're meeting all of those different requirements, as we know that they're quite vast. Another return on investment is the increased eligibility for reimbursement by third-party payers, whether it be commercial, sometimes through CMS, Center for Medicaid and Medicare, and with local and self-funded plans as well. What we're seeing more so than ever is a requirement to be accredited in order to get reimbursed. And one of the first questions that you have to answer on an in-network contract application with most of the commercial payers that are in our space. Greater financial opportunities through higher negotiated rates of reimbursement. if you do have in-network contracts and you're not accredited, or maybe you are, you can leverage data, outcomes, and a number of different factors that contribute towards the greater compliance environment to negotiate higher rates of reimbursement. Demonstrating quality, demonstrating positive outcomes, demonstrating success is going to give you a better leveraged position with different payers to get reimbursed at higher amounts. Insurance companies will reimburse for effective quality care. And now, so more than ever, they're seeking to identify areas where programs are not providing quality care and not tracking outcomes and not being in compliance, as being, eligible for no longer being reimbursed, or to, not re-sign new updated in-network contracts. So super imperative from a financial standpoint. Increasing staff competency and in compliance management. So one of the things I really appreciated when I was at North Star about going through the Joint Commission accreditation process is it helped give us an additional playbook or a set of guidelines that we could follow to ensure best practice and to continue to measure our improvement over time. And so it's super valuable to really subscribe to and adopt all of the required policies and procedures and standards of compliance in order to operate in a way that serves the individuals that are receiving services, but also for the employees all the way up through leadership as well. The final point we're making here is that it reinforces the quality of care and the patient safety. We know that we're in a pretty tight-knit industry, and it's fairly common to hear rumors or reputations about different people and different programs. And it's especially important to have attention to your quality of care and your patient safety, because we know that that's really going to translate into a lot of different discussions and conversations, potential admissions or lack thereof. So providing quality care, paying attention to and investing in a compliance program has a number of direct benefits that we've outlined here. And this is just kind of scratching the surface of what's possible in a strong effort towards the compliance program. Next slide, please. So now I'd like to unpack this quality versus quantity concept. And when there's a strong investment in the compliance program, there's a strong investment in quality documentation, quality of care, safety, we see a number of different benefits. Well-documented quality care increases average patient lengths of stay and positions revenue cycle management for success. As most of you know, there's a utilization department, a utilization review department, whether that be in-house or through some sort of third-party vendor. Quality documented care is what those individuals are using in order to get more days authorized, to be able to step up or step down folks in different levels of care. But the more quality that your documentation and the more compliant that your documentation is with licensing, with accreditation, and with payer guidelines is going to have a direct impact on lengths of stay and the quality of the care that gets provided. Responsiveness to staff and patient feedback increases the institutional confidence. We discussed that a little bit earlier as well. If you've got your individuals served and your staff members feeling confident about the organization and what it's delivering on and how it's responding to the different variables, you're going to see a lot more quality, you're going to see a lot more retention, you're going to see longer average lengths of stay by individuals that want to remain in that program and continue to stay through the continuum of care rather than discharging to a different program. Measurement of outcomes and actionable response can be leveraged with payers and utilized in marketing efforts. We see a huge push on our industry right now for using different third-party vendors to track your outcomes on a clinical basis. There's a number of different questionnaires and assessments that have been published by highly educated and credentialed individuals. That we see the PHQ-9 on the mental health side. We see the brief addiction monitor being a frequently utilized tool on the substance abuse side. And we see a lot of different vendors in the industry coming in and adding a lot of value. Glue and the Recovery Capital Index, NAATP released the 4C tool, and there's a number of other ones that are on the market as well, really adding value to providers and being able to track clinical outcomes, to be able to incorporate different factors such as social and environmental and vocational, to really be able to the best of our abilities, evaluate what's working and what's not. And really trying to decrease the number of admissions that a single individual has to have into a treatment provider program. So really taking that person-centered approach, circles around properly measuring progress or lack thereof. Poor quality of care decreases staff retention and reduces patients' average length of stay. We see programs out there that operate on a volume model. They're trying to get as many admissions as possible, and they're using that as a key metric. We see, more mature organizations really looking at average length of stay, outcomes, and effectiveness of care as it relates to not only their bottom line, but also their reputation in the industry and their marketing efforts and so on and so forth. Like we had mentioned, reputation in behavioral healthcare is key, whether it be referrals from outside stakeholders, alumni, families. The more confidence that the outside world or the various stakeholders have in your program, and the quality of the services that are being provided, the way that the staff are being treated, you're going to see a direct impact on the bottom line, and also just in the day-to-day satisfaction of the individuals working at the facility and the individuals receiving the care. Next slide, please. The next concept I really want to hit home on today is the importance of data. In today's day and age, all of the best companies in the world base their decisions on data. They have scorecards, they have different ways to measure data, they have massive ERPs where they house data, organize it, synthesize it, and use that data to tell the necessary stories to inform the changes and the revisions and the improvements and the pivots that businesses need. And this is not just specific to behavioral healthcare. This is in any industry, from a global, from a national, and a local level. Data is extremely important for making decisions about most anything in business, especially when your customers are individuals who are suffering and they need support. Historically, it's been very challenging to define outcomes in behavioral healthcare. The old historic model in substance abuse treatment is that you're calling at periodic, junctures in time to ask questions around, are you sober? And, what's your cravings? And are you part of a community of recovery? And this is some self-reported information that's being collected sporadically from an organization. And we've seen a lot of involvement, especially over the last 5 or 10 years, in using these evidence-based outcome measurements tools. And if you're not currently using one, there's a number of options out there. There's ways to do it at no additional cost. And we also have some great referrals for different vendors in the space that are providing this solution. So feel free to reach out if you're not collecting outcomes. At the very least, even if you're not interested in working with us for a compliance solution, we'd be more than happy to point you in the right direction in terms of data collection around outcomes. If you're not doing it currently, you need to be. It's not only a compliance requirement to be tracking and using outcomes to continue to update treatment plans and revise them along the way, but also there's just a number of different opportunities that you're missing out on if you're not properly assessing and using these outcomes measurements to understand the different social and recovery factors that are going into how effective your treatment is, even down to the individual clinician and group level. So incident report data is super imperative. We see a number of different programs with a very wide range in approach to incident management. And this really entails everything from the way that incidents are and the data that comes from incidents is collected, the way that they're either aggregated or not aggregated, and the way that the reports are able to tell the different story and inform the changes. So one of the concepts that Braden, our executive vice president, brought to the table from his time in the privacy, security, and compliance department at a huge healthcare corporation, Kaiser Permanente, is that incident data is the mulch for the organization's growth. An organization that is taking data from incidents, from feedback, from medication incidents, and using that data to drive improvements and decisions around increasing quality, increasing safety, reducing errors, reducing incidents, is constantly using this feedback loop to inform how they can continue to improve on the way they're treating individuals, the way that they're treating staff. There's a myriad of different ways that organizations collect incident reports and medication incidents. Sometimes this can be achieved through the EHR, which we feel like can be a little bit sticky. So if that's what you're currently utilizing, we would encourage you to reach out. Our software system has a seamless incident management and follow-up tool. It ensures accountability. It ensures that the process is properly concluded and followed up on, and that you're producing the types of reports seamlessly that educate you about what kind of issues are continuing to escalate, if you're seeing digression, or if you're seeing improvement, which is really the goal. So incident report data really narrates organizational issues and also opportunities. One of our clients is All Points North Lodge. We worked with them for a couple of years. We've done an amazing job in collaboration with them to capture incident report data and help the organization vastly and quickly improve in all of the areas that it has challenges unique to the setup of where their facility is and the size of the facility and the different individuals that are coming to the organization. We've been able to rapidly and continuously improve the way that the care is delivered and the way that the facility is set up, even down to the more granular ways of, who needs to be on which shift, which types of ratios that we want to see in the nursing department and the recovery advocate side of things. And we've really been able to leverage the data from the incident management system to inform important business improvement decisions. Data is also what you can leverage in payer negotiations and in marketing efforts. If you're truly collecting measurable data through a data source, that is a powerful tool, and some would even consider of currency. We work with, on the government side, government organizations and community-based programs that are subsidized by either grant funding or for state funding need to capture multitudes of different sets of data in order to continue to get that funding. Same with nonprofits. There's reporting, and it's directly connected to data that's collected from a variety of different sources of departments within the organization. So if you're not currently collecting sets of data across different departments, it's something that we would highly encourage you to start doing. And if you don't really know where to start or where to really go from where you're at now, we would just encourage you to reach out, and we'd be happy to coach you on what kind of options there are available and integrate some data collection measures and activities using our super cost-effective software platform. So our software platform not only helps to automate and manage all of those requirements for compliance, but also there's unlimited capabilities for data collection, which is automatically aggregated and can be reported. Data is a powerful tool. And if you're not using it as a tool in your current belt, I would highly encourage you to reach out and put some attention towards building in data collection measures, getting some baseline information, and then using ongoing collection to inform improvements in the organization, whether it be clinical, whether it be medical, whether it be operations, human resources, and beyond. There's no limits to the use of data and the importance that those stories tell. Like I had mentioned at the beginning of this slide, successful organizations base their decisions on data. Huge hospital systems, huge Fortune 500 companies, almost all their decisions at the highest level are made by data. And as our organizations in behavioral healthcare continue to evolve, as our industry becomes more and more professionalized, as we continue to grow collectively, it's important that we operate in the same way, with data really driving a lot of the decisions around how we can continue to improve, not only from a business standpoint, but more importantly, from a clinical and medical standpoint, to increase the effectiveness of our services and continue to see improved outcomes in the care that's being provided. Next slide, please. So I really want to put it back on folks to self-assess and really ask each of you who's participating today, how does your organization view compliance? What are the messages that either you as a leader or that the organization that you work for is communicating about compliance. Because we feel that if an organization is investing and they're adhering and they're really dedicated towards a strong, effective compliance program, it's sending a strong message to the staff and to the individuals served that there's a level of seriousness about everybody's safety and everybody's quality of care, and a commitment to consistent improvement as an organization. We believe that nothing truly stays the same. Either it's going this way or it's going that way. And there could be some variability within that, but very rarely in any instance does something stay the same. It's either improving or declining, whether it be a plant or a business, or whatever it is that you're looking at. So we want to challenge individuals and organizations to take a look in the mirror and say, how do we really view our compliance program, our approach to the way we manage our accreditation and our licensing, and what's the trickle down effect of that? So I really like this quote from Lisa here. Regulatory reforms and changing community expectations about organizational behavior have increased the emphasis on the role of culture in organization compliance. So what we're arguing here today is that the way an organization approaches its compliance program has a significant and direct effect on the culture of the organization. Next slide, please. So as promised, we're going to run through a high-level overview of some of the upcoming changes in regulation for behavioral healthcare. And this is to give a little bit of a high-level understanding of what folks can expect in the next few years to come. But it's important that everybody is knowledgeable and subscribing to the right types of information that's getting put out from the state, and information that we'll be putting out as an organization as well, to keep everybody apprised of the upcoming changes. So if you can jump into that next slide, Steve. Colorado has two major changes to the behavioral health regulatory landscape that are being implemented simultaneously. One is the BHE, or the Behavioral Health Entity Licensing. And number two is the creation of the BHA, or Behavioral Health Administration. So this presentation is intended to summarize the key points for Colorado treatment providers and clarify some potential points of confusion. Next slide, please. So the Behavioral Health Entity Licensure will be issued through the Colorado Department of Public Health and Environment. Licenses previously and currently are issued through the Colorado Office of Behavioral Health. CDPHE is basically absorbing oversight of substance abuse and mental health treatment programs. And so mental health providers were actually required to pursue, or at least initiate, the process of behavioral health entity licensure from July 1st of this year. So until the full changes go into effect, providers must also maintain their mental health designation on their existing licensure with the Office of Behavioral Health, or OBH. So it is confusing currently. There are a number of different conversations happening at the state and the provider level from various stakeholders, making sure that they are appropriately communicating and pushing out information about the changes. We're on top of that. Feel free to reach out directly to us. We'll have a slide at the end with some of our contact information, but you want to make sure that you stay on top of this. And if you're a mental health designated facility and you have not gone through this change yet and applied for this BHE licensure, you need to immediately. It's not too late to do so, but you could be looking at cease and desist or potential fines if you haven't already initiated application for the BHE as a mental health designated facility. So we've helped a number of different programs in Colorado to move through this change. We've got access to different resources that can help to do the knowledge transfer and give you the information and the policies and procedures templates to operate on to get into that compliance and to make sure that you get properly licensed as a BHE. So you may still apply for that licensure. And if you haven't already in your mental health designated facility, you need to reach out immediately to start that process. And if you want to get in touch with us, we can walk you through it. Next slide, please. Thank you. So BHE regulatory requirements are substantively different from OBH standards in some way. And the notable differences include the health and safety standards, environmental requirements, meaning at the facility level, and required clinical content. So in comparison to other states in the US, Colorado historically has been less cumbersome in terms of preparing and earning licensure. We feel and anticipate that is changing. The American Society of Addiction Medicine and Colorado were able to work together to update rules and regulations to be able to fall more in line with ASAM standards, which was a requirement for the state of Colorado as part of their Medicaid expansion and desire to collect more opportunity financially through SAMHSA to dole out through Medicaid programs and the community-based programs. So we can all expect more challenges related to licensing. And again, this is something that we as an organization are able to help programs with. It's our job to stay on top of it and be able to communicate and do training and knowledge transfer with programs that know that they're going to need to go through these upcoming processes. So the BHE licensure oversight will remain with CDPHE and transition to this newly established Behavioral Health Administration by July 1st, 2024. So it seems like it's a long way away, but all these changes are currently happening. So everything will have to be done by July 1st, 2024. So we can expect these changes that are already happening now to be continuously occurring over these next couple of years. Next slide, please. So House Bill 22-1278 created the Behavioral Health Administration in the Department of Human Services. The goal of the BHA is to create a coordinated, cohesive, and effective behavioral health care system in the state. And the BHA will handle most of the behavioral health programs that were previously handled by the Office of Behavioral Health. So enormous changes in the state regulations. Very important to stay on top of this. As I had mentioned earlier, a lack of compliance with state licensing and accreditation requirements mitigates or it increases the risk of the organization not being able to legally operate if anything were to put that license in jeopardy, or if the changes that were necessary weren't made during these huge shifts in the regulatory environment. Next slide, please. So the responsibilities of the BHA that are required to have occurred by July 1st, 2024 is a statewide behavioral health grievance system that we anticipate will be in the form of some sort of bidirectional technology, a behavioral health performance monitoring system to be able to internally monitor the effectiveness of services and different programs, but also for the state to have visibility into that as well. So getting on top of this now, putting these measures in place is going to make it so much more simple to make this transition into collecting and monitoring the behavioral health performance of your organization. There's going to be a comprehensive behavioral health safety net system. So it'll be interesting to see how that gets rolled out and what that looks like from a workflow standpoint, but also from a compliance standpoint. And then regionally based behavioral health administrative service organizations will fall under this BHA. And then on July 1st of next year, the BHA will begin licensing functions for all new or renewal behavioral healthcare entity licenses. So we see the July 1st, 2024 as everything having to have happened, but we can see here in less than a year, the BHA will begin licensing the functions for new and renewed behavioral health entity licenses. And then by the time July 1st, 2024 rolls along, the BHA will become the official licensing authority for all behavioral health entities. So in effect, the Office of Behavioral Health will go away and the Behavioral Health Administration will serve as the regulatory overseeing body of behavioral health care in the state of Colorado. Massive change, huge shift. We're going to see improvement in quality of care. We're going to see a lot more challenge in maintaining compliance. But fortunately, Simplifiance is here and able to support programs with any and all of these challenges that are upcoming. So just a quick overview of the services that we provide. Jump to the next slide for me, Steve. We have a unique set of offerings in that there are other vendors in the space that have software that addresses compliance and seeking to automate those systems. We also have a lot of other great consulting services in our industry that support from that capacity. Simplifiance does both. So we're really a one-stop shop for behavioral health compliance solutions. We do project-based consulting, as I had mentioned, the business had sprouted from helping organizations to earn their accreditations, to earn their state licenses, to earn the ASAM level of care certification, to be able to go, into different environments and be regulated by different bodies through certifications and otherwise. We have a wide range of experience on that project-based side. We also have a continuous compliance service, as I mentioned, which is a monthly subscription where you can get a dedicated compliance support specialist. We have a number of programs in Colorado that utilize that. It's great for organizations who are smaller and don't have a compliance department. You still need that support. Oftentimes, individuals who inherit compliance responsibilities come from an operations or behavioral health tech background. Those people need support. If your organization is so small that you don't have a compliance department, and the way that you're currently piecing together maintaining compliance is through a few individuals that don't have training or experience in that area, we highly recommend this service add-on to give some support, very cost effective, but knowing that you have someone to be able to call when you're updating a policy, when an incident happens and you don't know what the follow-up should be. We're here to provide that direction and provide those recommendations and give you the tools and resources that you need, not only to remain in compliance, but to feel confident about the strength of your compliance program and the response to incidents or some of the natural challenges that come up. The software that we have is not something that we're going to demonstrate today for folks, but it does a few things extremely well. It's fully integratable with other systems. But first and foremost, it captures incidents and medication incidents as well. So anyone in the organization by name or anonymously can submit incidents that have a full follow-up loop. So conditional logic can be built in for any kind of incident to flow to any kind of responder within the organization. And this is super important. The ways that you can run reports on that data is super seamless. So at the end of every month or the end of every quarter, you can easily see what the incident type was, where there was an increase, where there was a decrease, and start to really dive into that data and get those responses that will inform improvement as an organization and serve as that mulch. We also have a tasks function that comes out of the box with everything that you're required to do for either CARF or Joint Commission, and in Colorado for the current licensing standards. So every task is already pre-populated in the system of what needs to be done in order to remain in compliance with specific forms that auto-aggregate that data and can produce reports. So whether it's environment of care rounds, infection control, med room audits, HR file checks, we've got all the tools and resources built in the system that are populated on the frequency of when those different activities need to be completed, which can be done on the phone or a tablet or a computer. So we're saying goodbye to the binders. We're saying goodbye to these huge stacks of policies and procedures that are impossible to stay updated on and communicate to the organization. And we have that library function built into our system as well. So policies and procedures are easily viewable by anyone in the organization. You can navigate by department with keywords. And so policy enforcement and rule enforcement is a lot more reasonable to expect when individuals within the organization can access those policies and procedures, when they can easily and seamlessly submit incident reports or medication incidents, and also to be able to complete all the tasks that are required for accreditation. So those are just a few specific examples of our tool. It's super cost effective. It's not a pay-per-seat model. It's an unlimited user model. And the cost is a transparent billing model based on how much you use the system. So if you only use it for its basic functionality to make sure you're checking the boxes and remaining in compliance, it's going to be super, super cheap. And if you see the value of all the different forms of the data collection and you create forms to start collecting data in different departments above and beyond your requirements, then you're going to be paying pennies on the dollar for that data. And that's where your variable costs will be. But it is the most cost-effective solution currently on the market. And we're really excited to get this tool and have this tool in the hands of a lot of different providers. And we've got some great testimonials already coming out of how the software is improving compliance, how it's streamlining, it's saving compliance people time, it's removing the need to hire that maybe second or third compliance person. So it's a great tool for an organization that doesn't have a big compliance department, and can serve as a tool for whoever is managing it, or can get some support from us with oversight of that system. Or it's a great tool for a larger organization that does have a full compliance department. It's a tool that's going to save each of those folks more time. It's going to make their approach a lot more calculated. And it's going to make reporting up to leadership and to the different departments and powers that be so much easier. So those are our three services. We have project-based consulting, we've got software as a service, and then we have a subscription add-on if you want to have a compliance specialist that you can email and call. That pricing is based on how many hours of availability you want per month. We're super flexible. So we want to be able to help any program that has a desire to be in compliance. And we do everything in our power to be able to do that. So something that we're excited about being able to offer as kind of a unique product service right now is this accreditation compliance assessment, which we're now calling the Accreditation Compliance Evaluation, or the ACE. It's a very cost-effective way to take the temperature of your compliance program. So it's anywhere between $3,500 and $7,500, depending on the size of your organization, the amount of locations and levels of care that you have. We give you a full report of your standing with accreditation in relation to all the highest level important components of the 15 chapters of the Joint Commission or the multiple chapters of CARF. So it's a very digestible cost. It's done fully remote. We don't come on site and disturb day-to-day operations. We can set up the sessions over the course of 2 weeks or a month. And this is something that we recommend for someone that's in the middle of their cycle of accreditation or licensing, to be able to take their own temperature as to how compliant are we. A lot can happen in 3 years. We see turnover, we see changes in policies and process, giving us the opportunity to objectively review all the different ways that you're approaching the different compliance responsibilities per department gives you a really nice work plan to say, here's the gaps that we know that we're going to need to close prior to when the regulators come back out. And what we've seen is that organizations that go through this process see the value of working with an organization like ours to be able to make sure that not only are they staying on top of everything that they're required to do, but they can really make all that data and information meaningful and get a huge return on investment from the use of our support, whether it be through the software or through the folks that we have available on the project-based or ongoing consulting side. So that's enough about us. We can jump away from this slide. I think what we have time for now is some Q&A. So if there's any questions in the chat, Steve, I'd love to be able to answer anything that folks are interested in chatting about.
Sure, give me 1 second to bring that up. I don't see any questions in there yet. Does anyone have anything they would like to ask Parker while we have him for the next few minutes?
I must have covered everything.
Very, very thorough. If no one has any questions, leave it open for just another minute or two. I would like to thank Parker for taking time out of his very busy schedule, staying up to date on all the changes that are happening in the next 24 months here in Colorado, and running a company to come share a little bit of his wisdom with us this afternoon. It is very much appreciated. When I do send out the CEU credits and the follow-up email with the video, I will be sure to include contact information for Simplifiance in there as well. So if you guys have any other follow-up questions or interested in connecting with the folks over there, you'll have that information.
Awesome. Thanks so much, Steve. I appreciate you having me. If folks are dying to reach out they can go to simplifiance.com through our contact us or email me directly at psmith@simplifiance.com. So I'll look forward to connecting with some of you in the weeks and months to come. So I appreciate you having me, Steve, and hope everybody has a great rest of their day.
Thank you very much for coming, and have a good rest of your week.
All right, take care.